I think it's incredibly important to understand where we're going for the future of Aboriginal health workers, that we hear the stories of our mob. One of the legacies that I want to leave is to put the role of Aboriginal health workers and health practitioners on the map, so that they're not only more included into our healthcare systems and our models of care, but also understood and valued. And this project seeks to do that. And we hope that we can broaden that understanding by telling everyone about what health workers do and the value that they bring.
What inspired me to be a health worker? My sister did. She was a health worker before me, and she inspired me to dedicate my life to my mob. And I loved every minute of it.
I started off in Queensland Health, I think it was 1986, and I was a generalist, and then I became a diabetic health worker. We used to go out and check the people with sugar, make sure they had their medications and kept all their appointments and that. And then I retired, and it got too boring, so I went back to work. So I had a few different jobs, but I loved it.
My auntie Olive was already a health worker, and she said, Elaine, there's a position going at Aboriginal Health, would you like to apply? And my baby was only 7 months old. And I said, well, I'll give it a go. So I went and applied for it. I just told Marcy I got the job on one sentence. She said, Elaine, you've got to write something down. She said, just write, you want to, apply for the position? So I wrote that one sentence, and I had that the whole time, and my old boss took it. He said, Elaine, I'm going to keep this. So that was in 1984. I started as a health worker.
Health was in such a pitiful state in this country, and there were chronic diseases that were occurring throughout our nations that were just unacceptable. I'd lived with that, I'd seen that. We lived in very, very poor housing ourselves, overcrowding, lack of access to food, water, you name it. So growing up poor, I just wanted to see that we could do better for ourselves. We were marginalised, and what we had to do was to move our own margins in every aspect of our health. I was on the first health worker team in 1971. As health workers, we did everything. We worked in the hospital, we worked out of the back four-wheel drive vehicles, we worked in the parks, a shed, you name it, and it was pretty incredible, really, those times.
So when the Aboriginal Health Program started in around about 73 or 72, the infant mortality rate in the Aboriginal community areas of Queensland was about 123 per thousand, which is really, really high, and much, much higher than the non-Indigenous community. That infant mortality rate has dropped over the decades to in the late 20s, and it's still higher than the non-Indigenous community, but it's come down such a long way. And it's the role of the health workers contributing to that over those decades. It wouldn't have happened without that collaboration and that facilitation by Aboriginal and Torres Strait Islander health workers. It's not just the infant mortality rate. We had to get the vaccination rates up, and we had to get the hygiene messages out. It was the health workers that did all that.
In those days, we had a lot of our children, our kids, suffered a lot with runny noses and ear problems, parasites, sort of the common worm, scabies, head loss. That was another issue. So we were the team that we were set up to search and rescue.
We spent most of our time out in the homes and in the community and at the schools doing education. And I think it made a lot of our people aware of what problems are, and if they saw something that they were concerned about with their children, they'd ask.
We all had these big black doctors, remember? the doctor's bags. We'd have all our stuff in there, and everything we wanted, everything we needed was in that doctor's bag.
All the kids used to run to the car when they saw the car coming and wanted to know what's in the black bag.
Yeah.
And I used to always keep a packet of dried apricots. And I used to bribe them that way, you know, to sit still for me while I'd treat their sores or, you know, do their ear. I said, you've got to sit very still, and all that apricot was the magic.
You know, the kids started to improve, didn't they?
Yeah.
I could see an improvement when I was there, which says that we were doing a good job.
We used to do a lot of health screenings. So we used to go as far as Winton, Longridge, Barcaldine, Dingo, Doringham, Mount Morgan, Mara and Gladstone, and in Rocky. And then as our health workers, we progressed into getting trained. So we had health workers who became diabetes educators, who learned about ears, who learned about antenatal and men's health. So we were more professional and recognised for the work that we did as well. So we were the best in that little business of getting all our children immunised. All our women come to get their antenatal. So we did some good things in our early days as well.
The unique qualities of a healthcare worker is the connection to the community. You know, they understand the community, they understand the cultural groups, they understand the family dynamics, and they're able to interpret that in the healthcare setting.
I can remember when you do home visits and the people are really happy to see you, you know, they know that you really care. I think to connect with people and be a good health worker, you have to be dedicated, passionate about your role, and it has to come from your heart.
Look at me, I'm deadly. Open posture, beautiful smile. Give a wink and say, where your mob come from?
The importance of having an Aboriginal person, a health worker in the health setting is because our mob, they feel culturally safe. You know, even though we've lost our language, you know, we still got that way of talking to, you know, another Murray. You know, they say, how you going today? You know, they just all even nod their head. Some of them old Torres Strait Islanders, they wouldn't say anything to me, but they'd nod their head to acknowledge me, and I'd do the same back. And that's the way we'll get them to open up to tell us what's wrong with them. So the doctors can get on with the job and the nurses can get on with the job.
The health worker roles were very inspirational to themselves, their families and their communities. There was this new sense of pride happening with the growth of that program as it became larger, more funding, the health changed, the access to services changed.
I think the impact that we had was just, for me, in the short time that I was there, because I pursued nursing, but I was there for 2 years, was the number of people that accessed the service. It grew really quickly. You know, I think by the time I left to do nursing, you know, I would be confident we had nearly every Aboriginal and Torres Strait Islander person within the Cairns community and surrounds on our books. And that was like, I don't know how you explain those numbers and the numbers of people that were coming in there. Just to be there and be one of the people that's helping and providing something to our mob was important to me.
My mum and my stepfather used to come along here on the Toowoomba River here and provide nighttime cups of tea with sandwiches. So it's not only the people that can come to the clinic, sometimes you've got to go out there and do the outreach work to make sure that they're okay. So we're walking in the footprints of our parents.
And sometimes I think, I wish our parents were here to see what we did and what we're doing now.
Definitely, sister, definitely.
There was a lot of proud moments, but I think, you know, wearing a uniform as we did and looking after our own people.
When we went back to those communities many years later, this is 25 years later or more, and a lot of these babies that I had recalled birthing there on country at the time, they had moved into nursing and medicine. And I just couldn't believe it. It was just so beautiful. It was tearful.
We got a lot of young nurses and doctors, you know, from the Cape. And
Yeah, well,
I feel proud, you know. Oh, I know that kid, you know.
yeah, true.
I know that kid, and look at him today. It's just such a proud moment to see them succeed at something that maybe we did do something good.
I believe in life experiences that change and shape the way that you are as a person as a whole. In 2017, I had both my father and my uncle go through heart surgeries, both at the same time. So within the cardiac ward here at Townsville Hospital, I had my father who was pre-op and my uncle who was post-op. It was throughout this experience that I realized there's a real calling to help our people out in these spaces. It's not until you experience having a loved one being sick in hospital do you realise where's our support for our mob.
I remember a visit to my grandmother in hospital many years ago, and the treatment she received there was pretty average, and I think a lot of the staff weren't culturally aware of how to deal with Aboriginal people, and that was the turning point for me. I think I got a traineeship working within Wide Bay Hospital Health in nutrition, and then my journey just started from there to become a senior health worker.
What really inspired me to get into health was that I'm a diabetic myself, and knowing a lot of my people have died through chronic disease that we could help avoid just by talking to our people in our language.
My mother, who is very inspiring, she used to be a volunteer at the Cairns-based hospital in the late 80s, early 90s, and a lot of people used to come down from Cape York communities and the Torres Strait Islands and basically come with nothing. On the school holidays, we used to do hospital rounds, and I used to go with my mum, and she used to talk to people and advocate for people. I promised myself one day that I was going to become a health worker so I can go out there and educate people on primary health care and prevention and change people's lives.
My grandmother was a health worker back in the islands. So I actually thought, okay, I'll do a training. And to my surprise, I did the training with Dane. So,
you know, we helped each other through that course and built a great friendship that's lasted nearly 20 years. So, and now we're working together every single day, you know, so yeah, it's, you know, this line of work, it does that for you.
What inspired me to get into the health system was my father. I went along and did 6 months work with him when he was a social worker at Camberwell Medical Centre. And it was just amazing how he worked with the community and how nothing was too big. He always took the time to see people and chat to them. And I actually followed him in his footsteps. As a truck driver, at 40 years old, turned around and started working in health. And yeah, been doing it ever since.
I've seen health worker role change over the decades. When I've started, it was more that clinical health worker, support education in the community, whereas now it's more non-clinical type role in this space. A lot of the health workers are more community development, engagement, more like a navigator to the healthcare systems.
There's not the general health role now. It's expanded out to bigger things like, you know, if you want to work in specialising in health worker roles now, which is fantastic. Before it was more generic and general, whereas now it's actually you can move into areas that you actually would favour. That's the areas of dentistry, health working in a dental area, health assisting and health working in allied health areas, and also nutrition, chronic diseases. So, and it's a specialty area where you can receive training.
I ended up going to TAFE to do a Certificate 3 in Aboriginal Torres Strait Islander primary healthcare, to then become an Indigenous health worker at the Child and Youth Mental Health Service here in Townsville. Whenever there's an Aboriginal or Torres Strait Islander young person that comes through our service, myself as the Indigenous mental health worker, we automatically get tagged in to see this young person as well. What we do is ensure that the treatment and care of our young people that come through our service is culturally appropriate, and that when they're in the space in the clinic, that it's a culturally safe space as well.
So I work with male and female between the age of 17 to 1. Kids that have got trauma, kids that are suspended from school, and kids that can't get on with other kids at school. So we go back to country and we do cultural stuff with them. We get this thing called cultural tool. So what that is involved is it goes back to the history of the child. So where they come from, their mother's side, their father's side, and it teaches them then what their language is, where they come from, where their grandparents are from. So it goes right back to the history of these kids, which they don't even know nothing about. Some of the kids, especially when they know where they come from, they go back and they're proud of their culture then. Just before that, they didn't even know where they come from. And as soon as you start identifying where they come from, their background, and they're so proud of it. They're walking around and they never forget you, because they might see me up the street and say, "Uncle," like over 100 kids out at Warrabinda that call me uncle.
As a nurse, I had an opportunity to participate in an executive development program that Queensland Health was offering back in '93. I was probably one of the most junior nurses that got on that program, but that catapulted me into administrative and bureaucratic roles. I certainly didn't know what the bureaucratic side of the health system was even about, but I made a very deliberate decision to work in policy. I thought, wow, I didn't realise what policy was, but I worked out that working in a policy landscape meant that you could, maybe influence governments and what government were doing, particularly when for a long time government controlled our people's lives. And I thought, well, I want to be a part of, influencing government to enable and facilitate and empower our mobs' lives. And if I hadn't chosen to be an Aboriginal health worker, I wouldn't be here today doing the jobs that I've done.
Education is key to life, I feel, and my mother taught me that, so, you've got to listen to elders. After you finish the TAFE course, the health worker course, that teaches you about having access to services, about being accountable in what you do, about being available, advocating. And it's not just about you as the individual. It teaches you to think outside your square and about what you are bringing to improvement for across the board to Aboriginal and Torres Strait Islander people. And that takes a lot. And like for myself, I went into various senior strategic leadership positions where I've had to be the only Aboriginal person sitting at a table and trying to put our agenda across. And that's hard to do, but for me, I've always practiced common sense and respect. I'm non-judgmental, and I really put those traits onto people because I think that's helped me survive my journey.
And if you want to do something, you put your mind to it, you can do it. If you're with the right people and with the right attitude, that's all. And I say to people, it's not what you do, but how you do things. And not what you say, but how you say things. So that'll get you over the line every time.
Health's always been a part of my family, so it just seemed like a bit of a natural progression for me to move this way. And it's something that I think I'm pretty good at. I'm the manager for family health. I have a team of 22 staff. The team sits across 3 sites. They're very much an outreach team. I'm very fortunate that I have 2 traditional owner health workers. They're extremely knowledgeable. They're local people. They know their communities. They're extremely connected.
Our connection to our communities is very important. With remote communities, they don't build a rapport with fly in, fly out staff. And, with clinical staff changing on a regular basis, most of the time your mainstay is the health workers, and that's where the rapport remains, and they trust that person.
You know your people, you know their traits, you know everything. So, you know, when someone is sitting there talking to them and do you understand? Yes, yes. But, you know, in reality, if you answer yes, well, they won't keep asking you questions. The impact today that I see is that if the non-Indigenous stakeholders or service providers do have an issue with trying to communicate with our people, whether it's in the hospital system or, you know, out in the community, they're able to come back to us and ask us for advice. Whereas before, they never sought advice and just thought that their way was the way that you dealt with Aboriginal and Torres Strait Islander peoples.
I think the health journey for a lot of the community or the families has been influenced by the decisions we make and the support that we provide to the doctors and the nurses. We do give education to new doctors that come into the hospital. So we talk about cultural barriers, cultural discrimination. We talk about systems that impact the journey. We talk about access to services, social determinants. So health isn't just one thing. There's a whole lot of underlying issues that impact health, and how can we make that better? It's identifying that there is a housing crisis at the moment. People are homeless. They're not accessing health care because they can't afford to or they don't know where to go to. So we're that conduit. When they come into hospital, we support them and transition them back out into community to make sure that they're getting the best care and the best outcomes to reduce them from coming back into our hospital setting.
It's an extremely challenging space, but it helps you grow as a person as well. Some of the attributes that you need to have in our space are attributes that my mob have naturally anyway. They're patient, they know the community, they're connected, they're quick learners. Our mob learn very quick, and they can apply that knowledge.
You've got to be able to give a bit of yourself. Nearly every single person that I meet, I can make a connection through somehow where they come from. I can almost guarantee you I've got relatives anywhere on this side of the Pacific coast that they would know. And to make that connection, the qualities that you need, you really need to be patient. You cannot talk down to people. You really got to take the time to listen and empathise in the right way.
Bottom line for myself, you gotta be relatable. And sometimes for our young people, sometimes just having a laugh and having a conversation and just a yarn in general is what helps. Being respectful as well, and knowing that my background and my experiences in life are different to those that I see every single day. Not to treat anyone with shame or with judgment as well, and to be open-minded that there are more things going on in the world than what you actually see.
Honestly, it's been a very wonderful journey being in a health sector and where I work at within child health. I run a team called the Hearing Health Program, and I screen kids in all schools from prep to grade 4. Last year in 2022, I had picked up on a child that had congenital cholesteatoma. So he was born with that, and I had screened in his last year of the screenings that we do. And picking up on that and having him being sent away to Townsville and have surgery, and then to hear back from Mum made me feel really, really proud and really happy. Knowing that he now can hear properly and he knows that he can hear makes me happy, and it almost brings me to tears.
One of my proudest moments in Queensland Health was to start up a community hub in Hewenden and Richmond to bring vital, culturally appropriate health services and holistic healthcare services to the outback, where people don't have to travel 4 hours to Townsville to receive healthcare and basically be comfortable in their own community.
I did quite a years of boxing, 12 years, so I taught a kid, he was fighting on the streets, so walking the streets, and he was just belting people and getting in trouble and going to court and stuff. So what I did with that kid, I turned him around and took him to a North Queensland Games in Townsville, and he actually won the game. I said to him, well, put your thing where you can get something out of it, not that you're going to get in trouble for fighting, because you're actually in the ring. And so he went away and he won, I think, a Queensland, a Golden Gloves in a North Queensland Games. So even though he still rings me, he's got kids and settled down now, and he still rings every now and then when he's feeling down, but he's, you know, we talk, you know. That's one of the probably proudest moments of my life for that kid.
The proudest moment is when your patients are well enough to go home and come back in and ask you to have a cup of tea. That is the best, you know. Or they bring you a box of chocolate and we say to them, you know, you shouldn't be doing that. But they say, look, you supported me while I was down and just come back to thank us.
The reward is many, but I guess the key reward is respect, because respect is a very big part culturally for us. And if you've got respect, you've got people. And if you win that in a community, you basically will mold the next generation, because then you become a role model. You know what I mean? You're passing on knowledge and skills. And when you look at our culture, that's the way we've always passed on things, whether it's through man business or women business, each had their role. So it's just that now we live in the 21st century. You're just adapting other skills in a profession that you could possibly pass on to the next generation. And if you achieve that, like I said, what more can you ever ask for?
The best culture to fix a culture is their own culture. For me, as Aboriginal people, if we can get health workers and the Aboriginal people, we stand a good chance of saving the oldest cultural Indigenous group in the world.
What excites me about the future for Aboriginal and Torres Strait Islander health is it's really only up from here. You know, this younger generation coming through, getting their diplomas, being able to learn off our elders and our people already in the job, and then being able to link with medical professionals to get that extra medical background to really work together to close that gap.
I would love to see more young Indigenous people, men and women, within the health worker role, or a nurse or a doctor, so that our mob can understand what they're talking about when they go into a doctor's appointment, or when they go in to see a nurse, or when they come in and see a health worker, that they can understand all these big words and they can take that back and understand, all right, okay, I've got this, I know what it's about, all right, I can do it.
A journey in health is rewarding. Once you get in, there's many opportunities. And we often say, oh, you could just be a cleaner or you could just be a groundsman. We don't want that for our people. We want them to be well educated and have the same opportunities as non-Aboriginal people do, and move forward to closing the gap with qualified, culturally appropriate health professionals.
I've always had a view that we need to have First Nations people across the whole of our health system. I think it's one of the critical success factors. I think we need, you know, a voice in the system, our people in the system, a better coordinated system. And to get a voice in the system means to get on decision-making bodies and have a say, and that's starting to happen. If we get people in the system from gardeners to surgeons, then you get a voice as well, but you also comes with that a strengthened cultural capability of an organisation. If you have Aboriginal and Torres Strait Islander people, blackfellas working everywhere, it'd be great to see Aboriginal and Torres Strait Islander health workers and health practitioners and all of our healthcare teams as a normal part of what we do, that when we set up our models of care, that Aboriginal and Torres Strait Islander health workers and or health practitioners are a part of those teams without even a second thought.
I'd like to see people go further and further. I want to see more people like Haylene and people at the top of the list, you know. But I never want people to lose sight of the community care health worker.
We need to see more Indigenous, you know, health workers, so when our mob come in, you know, they're not frightened, or, you know, not frightened to speak up, because, you know, they're frightened.
We can't be without health workers in a space such as, you know, Torres and Cape, where we've got up to 75% Aboriginal and Torres Strait Islander people. So we need more, and we need the good people behind them to be able to back them in, support them, help them work to their scopes of practice, and actually give them the experience to be, so when we phase out, we can be sure that the next generation is going to be just as deadly.
Those that have come before us have built that reputation of being reliable, being knowledgeable about health. Thankfully for me and Gilly's generation of health workers, we have that great foundation, and we try our best to carry on that great legacy that has been started for us, and we want to encourage more health workers to come on board, so that we can teach them, so that they can carry that torch moving forward now.
Those old health workers who came way before us, they came along because they needed to make a difference in people's lives. They made a track, and that track was so long and so wide, but still rough. And they said the next generation that comes, their job is to follow through for what we started, and that was to make that track much longer, wider, and more smoother. And as generations come through, to my generation, it's now to do exactly the same thing, but prepared for the next generation, so that all the roughness and the hardships is gone. They travel on a smooth road like as if it was a highway. That's why I encourage many of our people, young people, to become health workers, because it's that next generation who'll do the same thing for the next generation to come. I leave it at that.